All right. Well, good afternoon, everyone. Happy Thursday. Welcome to this event. This is Story Slam um, narratives on health justice. My name is Jamie Trotter. I am the Associate Director for Patient Advocacy and Engagement here at Patient Advocate Foundation, and I am one of your hosts this evening. Tonight's theme, as I just mentioned, is a continuation from our inaugural Innovation Summit on health justice, and will feature narratives from storytellers across the country who are each working in their respective communities to make progress towards achieving health justice in their own way. A little bit of history about this event. We used to convene Story Slam annually as an in-person event here in Washington, D.C., but with the transition to virtual settings, thanks to COVID, we have decided to keep this as a virtual event, allowing us to have greater reach and participation from people across the country. So if you're joining us tonight, please do drop in the chat where you're joining us from. We love to know where our audience is listening in from and tuning in. To quote one of my colleagues here at Patient Advocate Foundation, we consider ourselves the megaphone, not the teleprompter. And what we mean by that is we like to describe our role as amplifying patient stories and narratives in an effort to provide each of you with tools and resources to use your own voice and become active participants in your healthcare, in your decision making, and to advocate on behalf of yourselves and your communities. This event is the culmination of a 2-year project in which we sought to truly engage and learn from 3 very different communities of patients, caregivers, healthcare professionals, all in an effort to build tools and resources that promote and support shared decision making. Tonight, you're going to hear from individuals from Richmond, Virginia. Here, you're seeing a photo of our working group members from Richmond, who are all advocates in their own right. They come with very real lived experiences and have lend their voice to this work throughout the year, are really around promoting access and how to ignite advocacy within their respective communities. You're also going to hear from storytellers from Los Angeles, which is a very resource-driven community, but has its own challenges with access as it relates to location and geography. We all know about LA traffic, right? So you're going to hear some storytellers from LA. And then our third community from the year was Ruleville, Mississippi, which is a very rural community, a community that was filled with a lot of love, a lot of joy, and a lot of passion around some of the systemic barriers that they faced in their community. So I'm excited to share their narratives tonight. So I want to thank all of our speakers for being brave and sharing their stories with us, as well as each of you for being here and taking time out of your schedules to listen. Our roles today are to be just that, active listeners, and to provide a safe space for our storytellers. We welcome your thoughts and comments. Any reactions that you may have, please do utilize the chat. We want it to be a highly engaged, highly active chat tonight. Last but not least, I want to thank my staff, not my staff, my colleagues, all of the staff here at PAF, as well as who I'm going to introduce, my next guest, who will be co-emceeing, co-hosting tonight with me, and will provide us and kick us off with the keynote. Dr. Rita Sharon is an internist and literary scholar at Columbia University in New York City. She is one of the founders of the field of narrative medicine. Dr. Sharon chairs the Department of Medical Humanities and Ethics at Columbia's Medical School and directs many narrative medicine projects throughout the university. Her work is published in major medical and literary journals, and she lectures extensively internationally. Speaking of lectures, some of you may have recognized her from last year's event, as well as from our advocacy curriculum on storytelling. So without further ado, I will turn it over to Dr. Sharon to kick us off.
Thank you. Thank you, Jamie, so much, but mostly thank you in the audience for coming and sharing with us both the telling and the listening of stories. Now, I'm going to start not with a trigger warning, but with a reality check. Because what we're to hear this evening is really the essentials of healthcare and the essentials of mostly the inequity and the absence of justice from the healthcare that we experience. We all are going to listen to tough stories as well as triumphant ones. There are transformative stories that we are about to hear. And as we hear it, I don't know how many people are in this audience, or this webinar, but each of us, no matter where we are going to be moved into sorrow, into rage, into cheering, into some kind of participation in what is being told. Now, I know that many of you, I hope many of you, were involved in the Innovation Summit that was featuring or focusing on health justice. And that is what we're going to be hearing about together. We're going to be witnessing both the absence of justice and the rage at inequity, as well as the accomplishments of those of us, and I'm going to include all of you in this us, who have been struggling in many, many different ways toward a more just system of care. You'd think in the US we'd have figured it out already, but we have not. Now, why stories? What's so special about stories? It is through these experiences of giving someone else, a stranger sometimes, a beloved sometimes, oneself sometimes. Don't you tell stories to yourself? So it's in the giving of the story that you expose things about yourself, that you locate where you are in the world. You know, when we talk about stories, we're not only talking about fact or fiction. We know that stories emerge from the teller as if from the life itself. There are obligations on both sides. There are obligations when you are giving a story that you're, reasonably accurate and not completely making things up. But the responsibilities on the receiver of the story are equally grave. And that's where all of you come in. We could not tell our stories without you being here. So you create the opportunity and the obligation to tell. Telling stories and receiving stories are risky projects. They're risky because there's no way but that you cannot be transformed. You are exposing yourself to change. You are exposing yourself as the listener to the teller's situation. And in listening to a story, we learn, we try to be in the place where the other is. We will this evening be in the place where the other is, whether it is a story of triumph and great achievement or not. So with that, we will hear from our first speaker, Jamie.
Yeah, so thank you so much for kicking us off and for grounding us in the event tonight. Before we turn it over to our first speaker, we do have, we're going to have a couple of polls that we're going to push to the audience throughout the event. And we're going to start with our first one. So the question is, have you or someone you know ever experienced challenges accessing healthcare due to systemic inequities? And so that is a yes, no, unsure poll question. If you could provide your answers, I'm monitoring feedback from my second screen. We'll leave it open a couple more seconds. Oh, well, I think we can end it there. It looks like a hunch. Okay, so no, we've got some more coming in. Okay, a few more seconds. Okay, overwhelming response. We're at 75% for yes. Yes, someone or they themselves or someone they know has experienced challenges accessing healthcare. We've got a couple of no's and one unsure, which is okay. That's, we don't know everything. But all right, I think with that, we can close that first poll. Thank you for your participation. And we will hear from Vanessa Spurlock, who is joining us from Richmond, Virginia.
Good afternoon, everybody. Yes, I am Vanessa Spurlock, and I'm part of the Richmond chapter that the NPAF has visited here. So September 2017, I was diagnosed with grade 1, stage 2B IDC, invasive ductal carcinoma. And I actually didn't share my story with a lot of people. I think I felt overwhelmed and I felt like I was transparent, but it was just so much to take in at one time. I didn't know what to say, didn't know what to ask. So of course, I Googled, and I was either going to live a long life or I was going to die the next day. But I actually met a group of ladies on one of the breast cancer sites, and I found that, speaking with them and then actually being able to have them as an outlet, it was, made my journey easier. So that same year, I worked for a school system, and at the beginning of each year, we get to pick one word. And the one word that I picked was choices. I had no idea at the time how many choices that I wasn't going to have, but that were going to be made for me. So and I know that being diagnosed is nothing compared to being in a relationship, but for as outspoken as I am, many times in the past, I chose not to speak up or I didn't advocate for myself. And of course, that has changed and my life has changed. And it didn't just change me in not saying anything, but it also changed me into having a voice. I feel like I'm now seen, I'm heard, and now I don't just speak for me, but I speak for other people as well. So I feel that I do it more for others because I've actually seen on some instances where they may not have had doctors or they may not have someone in a doctor's appointment that could speak for them, because I've heard of, disparaging stories in low, income areas and undeserved areas where they may not get the support or the help or the finances or even the transportation. So they feel like they can't say anything or do anything. My mom is 79 and my dad is 86. And I went with my dad to one of his VA appointments a few months back. And while I was waiting for him, it was a senior gentleman that was just wandering the lobby. And I asked him, I was like, who are you looking for? And he said, my wife was having a test done. And he had a piece of paper in his hand. And I said, well, where is she? And he just shrugged his shoulders and said, I don't know. So as my dad was in his appointment, I actually went, with him to the elevator and, helped him down and showed him where to go. And when my dad came back, he was like, who was that? And I told him the story, and he was like, well, thank you for helping him. And I told my dad, I said, but the bad part about it is he can't get to her. She can't ask questions. So who's going to be there to help them? And, he was like, well, I'm thankful that you're here with me. I said, yeah, but the thing about it is now they don't have anybody because he needed me. And actually, one of my survivor sisters who has now recently passed, last year she had passed. I don't know whether it was because delayed treatment delay of appointments, or just time. But I felt, and she felt like it took long for her to be seen. So I don't know that if she had been seen earlier, would that have made a difference? But I think that had the wheel turned a little quicker, that she might have had more time.
Mhm.
So I think a lot of times I feel like we don't know what to say, we don't know what to ask. And now that I am a survivor and now that I get to see the other side, I had an amazing team. I was blessed to have an amazing team and a great support system. But I've also seen the other side of people that don't know. And they're not people that are unlearned. It's just that they don't know. They don't know what to say. They don't know what to ask. And then they may have physicians that, you know, really aren't open enough with them to actually share with them what they need to know. It's like they can give them the 1, 2, 3, ABC, but sometimes it's those fine things in between that they actually need. So when I when I was asked to speak, I actually said, this is why I support and this is why I advocate. Simply because I know that I know what it feels like. I know what I've seen for people that may not get that. So, and oddly enough, I mean, seeing what I do now, I said supporting and advocating and be a voice, it actually comes natural for me. I feel like, you know, it's not even work. I feel that it's just an extension of who I'm actually meant to be.
Mm. Thank you, Vanessa.
Thank you.
Thank you. I hope all of you can hear what we just experienced together. That at the beginning, Vanessa was shocked. She got this diagnosis and didn't even want to share it with people close to her. And then she discovered that her own capacity to help others was bigger and more important than even protecting her own self and experience. And this is just a parable. This is a parable we just heard. You found yourself through suffering toward helping the other. And for you to call your colleague your survivor sister tells the whole story. Thank you, Vanessa.
Thank you.
Absolutely. Yeah, I wrote down the word choices because that really stuck out to me and moved me. So much of the work of advocacy is to promote choices and to encourage people to seek out choices. But we know there are so many barriers within our healthcare system that eliminate choices often for people. And so thank you for the work that you do. Thank you for being such a voice and so enthusiastic about this work, because it's impactful, it's meaningful, it's valued, it's seen, and we greatly appreciate your work.
Thank you.
Amazing. The chat is lighting up. We've got a lot of heart emojis for you. Melinda says, "Thank you for your story, Vanessa. You are amazing." And I echo those sentiments. All right. Our next storyteller is joining us from Los Angeles, Chris Bennett. You're up.
Thank you. I still remember walking into what felt like the most normal hospital. My mom checked in and went to the back. I sat in a pretty boring waiting area for what seemed like ever. I checked my phone, started to think about what I was going to do that night, and of course, started to think about what I was going to eat next. Finally, my mom emerged, gave me a half-hearted smile, and spoke the words that no son ever expects their mother to hear. They found something. It's cancer. My heart sank. The world seemed to blur for a moment, which felt weird because I had just come back home from my first break from school. I was having a pretty successful basketball season so far, had all the confidence in the world that you would expect a starting freshman collegiate athlete to have, right? I mean, a few nights before that, I was quite literally sitting in my coach's office talking about the professional teams overseas and the NBA G League teams that were interested in me, and life felt right. But in that instant, I genuinely felt like a child again, felt like I had no control, helpless, terrified. My mom, the woman who had always been my anchor, was now the one who needed some grounding. But this isn't a story just about her diagnosis. It's about what came next, what it really revealed about her, about myself, and about the system we all rely on when our health hangs in the balance. My mom was always very aware of the fact that she was lucky. She's a well-educated, self-aware white woman who had a really good career that offered her health insurance. We always lived in cities that had access to highly rated hospitals. If anybody was going to be able to navigate this and win this, and win kind of like the healthcare system successfully, it was going to be her. And yet, it was still a labyrinth. Appointments were confusing to schedule. Referrals felt like running in circles. One specialist sent her to another who needed paperwork from another. Oncologists spoke in jargon-laden terms, making decisions that felt impossibly high stakes without explanations we could fully understand. My sisters and I really leaned into each other during those long hours of research, trying to decode what was happening to her body and what treatment options were going to even be best for her. But even with all of her privileges, the barriers she faced were scary and plentiful.
Mhm.
Delays in approvals for scans, out-of-pocket costs that made her hesitate before saying yes to tests, the mental toll of constantly advocating for herself when she was already physically exhausted. I began to wonder, if this is a reality for someone like her, what must it be like for folks that don't have the same resources? My mom's battle was not just with cancer. It was with a healthcare system that seemed to resist helping her at every single turn. And it wasn't just her fight. Every appointment and interaction unearthed some stories of others who were struggling harder. I remember sitting there and watching an uninsured woman in the waiting room with two small kids quietly crying as she had to review the bill that she got. There was a man who I remember getting his bill and getting information, and his English wasn't fluent. I remember sitting there listening to this Black family who had drove hours from the Inland Empire to Los Angeles because they didn't have the necessary technology at their center to be able to get the care that they needed. I couldn't stop thinking about those moments, couldn't stop thinking about those people. They stuck with me like glue, filling me with a restless energy that I really could not shake. Even as I sat with my mom during her treatment and was consumed with working of ways to find ways to be there for her, I couldn't ignore what I was seeing. It was impossible not to see how much easier our path was simply because of who she was, and I was way too aware to not be deeply disturbed by how unfair this was. My mom's journey, while in no way was easy, ended with a successful remission, and I will always be grateful for that. But this experience left me a mark on me, an awareness rather, that I honestly can never unsee. Her survival wasn't just about medicine or luck, it was about access. And I kept asking myself, what about everyone else? I started doing some research, I started really digging. I wanted to understand why these disparities even existed and why were they so pervasive. I all too fully understood and recognized racism as a young Black kid growing up in America, but I didn't understand how deeply ingrained these disparities were in all of our systems. Why were Black men more likely to die of prostate cancer than white men? Why did Latinas have lower rates of breast cancer but higher rates of dying from it? Why was the life expectancy of indigenous populations consistently lower than that of any other group? The answers were complex but undeniable. These outcomes weren't just the result of biology, they were results of policies, practices, and systems designed to exclude certain people, sometimes unintentionally, but other times intentionally. Health outcomes were tied to income, education, race, gender, sexual preference, and geography in ways I'd never understood before, and I knew I couldn't just stand by. So after I finished playing professional basketball, threw myself into the world of health equity, really steep learning curve. I found myself surrounded by incredible advocates, brilliant researchers and mentors, and of course, community leaders who had been doing this work for decades. Wasn't sure where I fit in at first, but I kept going, digging it deeper and deeper. Today, my work is deeply tied to the values I learned during this time by my mom's side. I advocate for funding programs that ensure equitable access to screening and treatments. I push for policy changes and hold institutions accountable for disparities in care. I help design initiatives that center the voices of communities that are often ignored in conversations about health. Every project I take on, I see my mom's face. And I see the faces of those who sat in the waiting rooms with her, who didn't have the same privileges she had. That this work isn't easy and oftentimes feels thankless, but the systems we're trying to change are deeply entrenched with challenges and barriers, and progress can sometimes feel slow, and that's okay. And the one thing that I've learned about that is the smallest victories matter.
Yes.
A single grant program that funds screenings for an underserved neighborhood, a community-based cancer education initiative that reaches men of color, who would have systemically been excluded if they didn't have this, or even a partnership that builds trust where none existed before. All of that matters. All of those are wins. So when I tell my mom about the work I do now, she always smiles. She always tells me she's proud of me and the type of work I've chosen to pursue. I've never fully thanked her for letting me be part of her journey. And I've never fully expressed how meaningful her experiences and bravery were and how they've helped shape my career. I think she sort of understands the importance her journey has played on the work I do, but I don't think she fully has seen the complete impact of it. The strength to fight, the courage to confront injustice, and the belief that even the hardest battles are worth fighting all came from watching her navigate these situations. Her story became my story, and together we're part of something much bigger, a fight for health equity that's been long overdue. Thank you.
Go ahead, Jamie.
Thank you, Chris. I did not have the pleasure to meet Chris in LA this year, but I have worked with him in preparation for this event, and this story always just brings a huge smile to my face because I think it perfectly describes the challenges with healthcare. We can speak to the systemic issues that a lot of underserved or underinsured communities face, but this also highlights such a problem that heavily resourced communities still have some of the same, if not different, very different struggles with navigating our healthcare system. And I think that the fire that it's sort of ignited within you is remarkable to see. It's what drives a lot of us in this field, and being able to tell her story in such a triumphant way, turning such a negative experience into power, sort of reclaiming your power and making sure that, another woman, another man who do have access can navigate this system in a way that's impactful is great to see and a joy to watch. So thank you for your work. Thank you for sharing your work, showcasing your work, and really honoring your mom's story in a way that's so impactful.
Wow. And we can see as we hear you and watch you with your LA cap and your picture behind you, we locate you, we say, this is a man of extraordinary courage. He could have gone on, probably become a coach, I don't know. Still in basketball? No. You responded to the injustice. It reached you, and you answered. We will never forget this. You answered. Thank you.
Thank you.
Yeah, the chat echoes our feelings as well. Chris, thank you. Such a powerful reminder that it's not just the patient that is impacted by an illness. And Martha shares and says, thank you for such an amazing story. And thank you for your vulnerability. Amazing. All right. I think it's time for another audience poll. So if we can get that loaded, poll number 2 is, what do you think is the biggest barrier to health justice? And this is not a multiple choice, but it is multiple choice. But choose one: economic inequality, racial and ethnic disparities, a lack of education about health resources, or geographic location. Let's see, we've got, ooh, it's kind of split. All right, this is interesting. There's no clear winner, although we've got, actually, it's changing rapidly. 41% of the audience thinks that economic inequality is the driver, the biggest barrier to health justice. And then tied for second, we've got racial and ethnic disparities, as well as a lack of education. And I see that for some reason, Francis is not getting the poll. So I'm just calling that out for our tech support to see. I'm not sure why that's happening, Francis, but I do want to acknowledge. Okay, so I think there should be a poll button at the bottom of your screen. that may be able to assist you with getting access to the polls. All right. Yes. Okay. And now we are going to take it to Mississippi with Mildred Wilson, who is going to share her story.
Hello, everyone. I can remember back in the mid-70s, my father was diagnosed with lung cancer. Living on a plantation with limited income, a large family, no health insurance, and limited health care provisions led him to experience many painful and sleepless nights. We had no outlets and no resources. And Vanessa stated earlier, she used the word choice or choices. We had no choices. And it's sad to say that even now, in the year of 2024, we are still have very few choices. I have worked with the community. I have worked as a community health advisor with the Fannie Lou Hamer Cancer Foundation for well over 20 years. The Fannie Lou Hamer Cancer Foundation is located in the heart of the Mississippi Delta, where over 30% of families live below the poverty line and dying prematurely from a lack of health care. We partner with other agencies to provide annual health care services to uninsured or underinsured females between the ages of 44 to 64 years who rarely or have never been screened for breast or cervical cancer. We also provide PSA screening for males who are 45 and older. We assist the female clients, and sometimes the male clients, in scheduling their appointments, finding transportation when needed, and even paying the co-payments if necessary. The Mississippi Delta has so many health challenges, especially when it comes to people of color. We have difficulty affording health insurance. We delay seeing the doctors until it's an absolute must. And by then, some of the clients are already in critical stage. We have limited access to healthcare specialists and other medical providers, long wait periods, brief appointments. You must be referred by a doctor to see specialists. We can visit after our clinics, but you must pay for an office visit. Unemployment is another problem. It's hard to eat healthy on a limited income with several people living in a household. Families are eating just to survive, which is unhealthy and eventually cause some health problems. We see and hear of so many misdiagnosed cases here in the Delta so we just about become fearful and afraid of doctors and what to expect. When we do visit doctors, we are less likely to receive timely medical care and more likely to experience medical errors. We're given a prescription, oftentimes more than one, and rescheduled for another appointment later. No tests are run to identify the problem. So we're basically being treated for the symptoms and not the problem. Oftentimes we don't see specialists because we're not referred. And if we are referred, transportation is a major problem because it could be hours away. Even a visit to the emergency room here in Greenwood, Mississippi, where I live, takes hours before being treated. For example, a few months ago, a mother rushed her 8-year-old daughter to the emergency room because she was having a severe asthma attack. The nurse in charge refused assistance until the mother completed all the necessary forms. 45 minutes later, the child was dead. These are practices that are often involved people of color. An emergency room is just that. It's for emergencies. The prevalence of diabetes in the Mississippi Delta is significantly high, with people suffering from undiagnosed or poorly managed diabetes. This leads to so many people having to get extremities amputated. This occurs more often in the Black community than any other community. There are also times we're treated for something that is non-existent, which is a medical error that causes other health issues. The few healthcare providers who are available are usually overworked and underpaid. That may affect the quality of care that we receive. The Fannie Lou Hamer Cancer Foundation organize and attend health fairs. We disseminate pamphlets, brochures, and intake forms to the community. This organization provides 12 weeks of training for the community health advisors involving both males and females. The community health advisors are tasked with the duties of educating and informing the community of breast, cervical cancer, and prostate cancer. We are making a difference in the Mississippi Delta. Thank you for listening. Thank you for giving us this opportunity, and thank you for listening to what we have to say.
We had to hear what you have to say. What you just told us is essential for those of us who have dealt with systems of care that are faulty, for those of us who are more lucky to have systems that work a little better. Did you all notice how Miss Wilson talked about her experience? She talked about her experience in a matter-of-fact, poised, almost relaxed tone of voice and address, as if she were not talking about horrors that the 8-year-old child with asthma died in that emergency room waiting for the forms to be filled out. So what that tells me is how common these situations are. All of us listening are now more aware of the common, the way in which these are not extreme. These are ordinary kinds of stories from places in this country. I hope all of you in the audience are as chilled as I to hear this very matter-of-fact description of what life is like for you and your neighbors in that Mississippi Delta.
Absolutely. Yes, I've been looking at the chat. Martha says, Mildred, I'll be shaking my head for a minute. And I think that's pretty much sums it up. We all are shaking our head. Carrie also offered up, thank you for your story and your important work. I've had the opportunity to visit the Ruleville, Mississippi, and meet with Mildred and the community that she works in. And as I said in my introduction, yes, this is a matter-of-fact story because it is something that has been their lived experience for some time. It's deeply rooted in history and not present day reality. But one of the things that I am most struck by I didn't get to visit this year, but the last time that I was there was this sense of pride and sense of community and love that is shared with their neighbors. I mean, our partner gathered this group together and they show up and they are enthused and they are willing to work and they are hopeful despite so many challenges that they have faced throughout their lives. So thank you, Mildred, for telling this story, for the work that you do, for being so engaged and so activated in advocacy.
Thank you.
All right. I think I've got one more poll for the audience before we move on to our next speaker. So if we can launch poll 3. Do you believe everyone in your community has equal access to quality healthcare? Some keywords in there. Equal access to quality healthcare. So we've got some responses coming in. And I think it's reflective of the stories that we've been hearing tonight. An overwhelming 87% so far have said no. They do not believe that everyone in their communities has equal access. We've got one yes, one unsure, but I think we're up to 88% now saying no,
Mm.
which is pretty telling. All right. We can end that poll. And we will now hear from Mr. Reggie Tucker Seeley, who joins us from Los Angeles, California.
Great. Thank you, Jamie. So the title of my story is What Health Justice Means to Me and my pathway to creating my own health equity consulting company called Health Equity Strategies and Solutions. As Jamie mentioned, my name is Reginald Tucker Seeley, and my pathway to working in health equity has been a non-traditional one. I was a first-generation college student. I have an undergraduate degree in accounting, and I worked in the accounting and auditing field for about 5 years. After leaving accounting and auditing, I got a master's degree in counseling and family therapy because I thought I wanted to get a PhD in clinical or counseling psych. While this degree highlighted that that was not the pathway for me, as a gay man who was newly out fully to myself, this degree program did help me to explore coming out in the other areas of my life. It was also during this time that I was working on my master's thesis for that program that I stumbled across the phrase social determinants of health. It was that phrase that would shape the next 20 plus years of my career journey and introduce me to the field of public health generally and social and behavioral sciences within public health specifically. I was fortunate to train in public health at the Harvard T.H. Chan School of Public Health, and I was at Harvard for about 15 years. I completed master's and doctoral degrees there, as well as a postdoctoral fellowship in cancer prevention and control at Harvard and the Dana-Farber Cancer Institute. I also stayed there as an assistant professor, where I developed and taught a course called Measuring and Reporting Health Disparities. At this time, I was also serving on the Rhode Island Commission for Health Advocacy and Equity. And this group was legislatively mandated to develop and publish the state report on health disparities. At the time, I had no idea how to write a state-level health disparities report, and I figured that if I didn't know how to do it, that many of our students in the department where I worked didn't know how to do it either. So with the help of our Dean for Case-Based Learning at the time, Dr. Nancy Kane, and her team, we developed a 3-part case study about my experience that took students through the process of writing a state-level health disparities report, where Part A focused on defining terms, Part B focused on selecting health outcomes and data sources, and Part C focused on methods for measuring differences. I loved teaching this course. And the best part was hearing from students after the course ended, when they were doing exactly what we did in the course in their work environments. And they could lead the discussion or effort focused on measuring and reporting health disparities in their work environments. This case study led to the development of the first draft of my framework for how organizations and committees and coalitions and communities could address health disparities in their respective communities. The students loved the course. I won a teaching award for the course, and the evaluations were always really good. However, I recall there was that one evaluation that wasn't as good. And it stated, while this course was a really good course, there was no focus on federal health disparities policymaking. Well, this was because I wasn't familiar with federal health disparities policymaking. So I looked for experiences or opportunities to learn more about federal health disparities policymaking, and I found 2 fellowships, the White House Fellowship and the Robert Wood Johnson Foundation Health Policy Fellowship programs. The RWJ Health Policy Fellowship program included a 3-month orientation on how federal health policy gets made, and then an 8 to 12-month placement in a legislative or executive branch in Washington, D.C. As soon as I learned that, I knew that the RWJ Health Policy Fellowship was the experience that would help address the lack of federal health disparities policymaking in my course. So I applied. Now, during this time, I was also recruited to the Leonard Davis School of Gerontology at the University of Southern California. I said yes to USC in December of 2016, and then in February of 2017, I was selected as an RWJ Health Policy Fellow. So for the 2017-2018 academic year, I was in Washington, D.C., and my placement was in the United States Senate. And since I was a new resident to California, I wanted a California placement. And I was fortunate to match with the office of Senator Dianne Feinstein.
Wow.
Now, this was the most remarkable career experience to date because I saw firsthand the policy pathway to change. And the silence at the federal level during this period related to health disparities was absolutely deafening. Now, fast forward to the spring of 2020. I'd been back in LA for 1.5 years, and then the COVID-19 pandemic hits. And as you will recall, during the spring or summer of 2020, several highly visible cases of police brutality against Black and Brown folks also hit the news. The combination of the pandemic, the anti-Asian hate crimes, and the police brutality cases amplified discussions related to health disparities and systemic racism during this time. It was also during this time that I was starting to feel like my work was not having the impact I wanted. In particular, I was seeing folks on the news talk about health disparities in a way that seemed like they weren't aware of the decades of health disparities research. For example, the inequities we saw during the pandemic were no surprise to any health disparities researcher. Yet many on the news were shocked that racial and ethnic minorities, older adults, and those with fewer socioeconomic resources were hardest hit by COVID-19. This felt like an opportune time to leave academia and to pursue opportunities that would allow me to apply my research and policy skills to make a difference in the health disparities that were now being discussed more often. I saw several organizations at the time creating senior roles to develop and implement health equity strategy. And fortunately, a research partner of mine created such a position. That organization was Zero, the End of Prostate Cancer, and they created a VP of Health Equity role. I then interviewed for and was selected for this role. My responsibilities were to develop and implement the health equity strategy to address the disparities that Black men experience in prostate cancer. And given the newness of this role, I generally felt like I was all alone. I reached out to those with similar titles on LinkedIn to connect to and at least feel a sense of community and to learn what others were doing. And throughout my time in this role, I consistently realized that awareness about much of the research about the differences in health by race and by place had not made its way to communities. Of course, those communities understood that work because they were experiencing these inequities. But also many organizations were struggling with what to do after they made that initial commitment to address health disparities or inequities in their communities. This is where I felt that the framework I developed from my many courses, informed by my community work as well as my policy experiences, could be helpful. So I decided to create my own consulting company, and I named it Health Equity Strategies and Solutions, with the goal of helping health-related organizations, departments, coalitions, and communities to move past merely describing sociodemographic differences in health and to begin developing, implementing, and evaluating health disparities elimination strategies in order to achieve health equity for historically marginalized populations. The framework starts with organizational commitment, where senior leadership makes a decision to address demographic group differences like by race, by place, by gender, in health or clinical outcomes, and they align on definitions for those key terms. The framework also includes steps such as outlining process for selecting health and clinical outcomes, methods for measuring differences, and also evaluating the impact of programs to eliminate disparities. And at the center of this framework is engaging with the communities experiencing disparities and organizing with those communities to achieve equity. Health justice means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to a usual source of healthcare and coordinated high-quality specialty care, and ensuring that families have the resources to manage their health and navigate the primary and specialty care delivery system. Now, those are nice words to say, but implementing health justice requires empowering communities to know that differences in health and healthcare outcomes exist, understanding the historical and current factors that contribute to those differences, and having the resources, both human and financial, to eliminate barriers and to create more equitable systems that work for all of us. Thank you.
Oh. Thank you, Reggie, for bringing us through that metamorphosis. I'm reflecting on the very different forms that we've heard over this session. Vanessa, something happened to her. There was suddenly a diagnosis of a serious illness, and she surmounted the impulse to to keep that quiet. And she surmounted it because she realized that others could use her help. So she went from her own situation to being a real force. She was running support groups for 40 women at a time. And it was within this one category of cancer, not just breast cancer, but and so that's a model of how what came to you, what called you. In her case, it was her own illness.
Mm-hmm.
When we heard from Chris, it was the illness of his mother,
Mm-hmm.
and how that illness transformed his trajectory.
Mm-hmm.
And he left the basketball that he loved,
Mm-hmm.
and he became a real diplomat
Mm-hmm.
for justice,
Mm-hmm.
totally, completely saturated. And then we heard from Mildred, who was in her specific community and knows only too well its limitations and its enraging
Mm-hmm.
systems of injustice.
Mm-hmm.
And no matter what they were able to do, were always, how can I say, irrevocable.
Mm-hmm.
And we saw it even just in the tone of her voice and the set of her head.
Mm-hmm.
How irrevocable those things were.
Mm-hmm.
And then you come with a whole other geography.
Mm-hmm.
And it's not one illness, one parent, one delta. It's like, what do we got here?
Mm-hmm.
With the capacity to move from, no, I don't want to be a counselor. I'm going to disregard that. No, I don't want to do this.
Mm-hmm.
But it wasn't dilettantish. It was moving toward the prize.
Mm-hmm. Mm-hmm.
And you have just managed to articulate the prize, which is knowing enough about the whole system to be able to intervene.
Mm-hmm. I would say I was going to say two things have really, informed my pathway. So as I mentioned, I was a first generation college student. I'm originally from Arkansas, and my family is actually from Eastern Arkansas on the border between Arkansas and Mississippi. And I would say as a child, I saw a level of poverty in that part of the country that has stayed with me.
Yeah.
That consistently motivates me to work towards
That's great.
ensuring that poverty isn't a barrier to high quality healthcare. And I think the other thing is the fact that I am a Black man and I'm also a gay man, so I'm managing multiple minority identities that I have to navigate the systems. And I'm with those minority identities, so I'm well aware of the barriers that also present for those of us that are navigating and managing with minoritized identities. Yes.
Yep. But the point here is how many different singular avenues there are toward a kind of triumph. And we've heard 4 versions of triumph. And we understand how powerful is our opponent.
Yes.
Agreed.
Jamie.
Sorry, Reggie, to cut you off, but yeah, I was just gonna chime in. As you were speaking, our organization and Reggie, we've known Reggie for some years now, but this is really the first time I'm hearing his entire trajectory towards where he is now. But as he was speaking, and as I was reading the story before the event, all I kept thinking of is if you want something done the right way, you do it yourself. And so that's kind of, I'm like, okay, Reggie, and I'm looking at the chat. We've got some similar sentiments. Melinda said, I love that you made a whole company in caps, dedicated to the cause. Kudos to you. Martha has said that Reggie loved how you rose to the situation. And Carrie shared incredible work, weaving all of your experiences and curiosities into such a positive impact on us all. Thank you, Reggie.
Well, this touches my heart so much because my primary program of research, which I didn't mention, was financial hardship and cancer.
Oh.
And I developed a model sort of looking at the financial hardship that families experience as they navigate the cancer care delivery system. And so if you look back on my career trajectory, it totally makes sense that that's my program of research. While I was in it, it was very stressful making all of those changes, so I don't want to minimize that. But I am so committed to doing this work to ensure that a diagnosis of a chronic condition is not financially ruinous to households, and bringing all of my skills hopefully to help with that.
Beautiful.
Thank you. Thank you so much. All right. And now I get to transition us into a bit of a period of reflection. This should be a calming experience and fun. I'm going to introduce, I'll let her introduce herself, but my colleague Amy Geroy is going to join us now and walk us through a guided exercise. I'll leave it at that.
Everybody, thank you, Jamie. Yes, I'm Amy Geroy, and I work in the Patient Education Department at PAF. I'm also a 500-hour registered Kripalu yoga teacher with specific trainings on meditation and breath work. So today, I will guide you. It'll be a 10-minute relaxation session. So this is really a time for you to just focus on yourself. I'm going to lead a couple breathing techniques and conclude with a meditative body scan, some visualization, and close with a period of silence. So if anything ever feels uncomfortable, feel free to modify as needed. A little bit about breath work and the rest. They are 3 powerful techniques used to enhance physical and mental well-being. These practices are increasingly recognized for their roles in stress management, mental clarity, and overall health. By understanding and using these tools, you can cultivate a deeper awareness of your body and your mind, promoting relaxation and resilience. So let's begin. You might want to uncross your legs. Find your feet firmly on the ground. Hands can rest on your lap, head over heart, heart over center. Your eyes can relax. Your jaw relaxes. Your shoulders relax. And if you haven't already, I invite you to close your eyes or find a soft focus on the floor in front of you. Slowly start to deepen your breathing. Notice the natural flow of your inhalation and your exhalation. As you inhale, imagine you're drawing in a sense of peace and calm. As you exhale, feel any tension, stress, or worry leave your body. We will start with 2 different types of breathing exercises. I'll guide you through both. I call the first a double inhale. We'll take 2 inhales. Again, I'll guide you. And 1 long exhale. Big breath in. Breathe in again. A long, slow exhale, ha. 1 more time. Big breath in. Breathe in again. Long, slow exhale, ha. Feel your shoulders relaxed. Keep your breathing through your nose now. And as a personal challenge, see how long and slow and deep both your inhales and your exhales can be. Long can you make your inhales and your exhales? Keeping your breath slow, and explore the depth of your breath. Long and slow, deep. Find and focus on a spot in your body where you feel your breath the most. And bring your attention to just the pure simplicity of each breath. Keeping your breathing long and slow and deep. Now, bring your attention to the physical body, starting to notice the breath as we have been. Feel the gentle rise and fall of your abdomen as you breathe naturally. You're not trying to change anything. Just notice the rhythm of your breath just as it is. We will now move through a body scan to release tension and bring awareness to different areas of your body. As I name each part, simply bring your attention there and silently repeat its name in your mind. You don't need to move or adjust, just observe. Begin with your right hand, right wrist, forearm, elbow, upper arm, shoulder, right side of your chest, your waist, your right hip, thigh, knee, top of your foot, bottom of your foot, and all 5 toes. Relax your shoulders, relax your jaw. Now move your awareness to your left hand, left wrist, forearm, elbow, upper arm, shoulder, left side of your chest, your waist, your left hip, thigh, knee, top of your foot, bottom of your foot, and all 5 toes. Relax your shoulders, relax your jaw. Bring your awareness to the back side of your body. Feel your heels, the backs of your legs, your lower back, your middle back, upper back, shoulder blades, back of your neck, back of your head, and come up and over the top of your head, moving your awareness to your forehead, your eyes, your nose, your chin, throat, your chest, and all the way down to your feet. Allow your body to be fully relaxed and still as we enjoy 10 seconds of silence. Now let's move into a space of visualization, a journey within your mind's eye. Picture yourself standing at the edge of a calm, serene lake. The water is still, reflecting the sky like a mirror. The air is fresh and crisp. Gentle warmth of the sun touches your skin. You feel completely at peace, connected to the earth beneath you, the sky above you, and the stillness within. You walk along the shore, feeling the soft sand beneath your feet, each step grounding you deeper into the present moment. You find a comfortable spot to sit, gazing out over the peaceful water. And as you sit, you notice that the surface of the lake mirrors your inner calm. And each breath you take deepens a sense of tranquility, as though you are merging with the stillness of the lake itself. Take a few moments here in this peaceful place, allowing your mind to settle into the calm, soothing energy of your surroundings. Gradually begin to bring your awareness back to the physical body, the space around you, and the room you're in. Start by deepening your breath, feeling the gentle rise and fall of your abdomen once again. Wiggle your fingers and your toes, and gently bringing movement back into your body. Take a moment to notice how you feel, calm, grounded, and at ease. Let this sense of peace stay with you as you move into the rest of your day. Thank you for joining me in this practice today. I'll take a deep breath together. Deep breath in. Exhale completely. And when you're ready, you can slowly open your eyes. And we now get to close with Gwen, Darian. Enjoy your evening.
Thank you, Amy. That was really wonderful after those stories and after listening to the, I don't know, I always end up after these stories with less to say than I usually have to say because I'm still just taking them in. I am thinking about what everybody said and also the incredible way that Rita Sharon kind of closed and brought everything together. It is, they were three stories with very different perspectives, but so many commonalities. Because when I listen to these stories, it reminds me how much how we kind of all are working when we're working in this space of health justice, how we are all, at the same time, how we are enraged, how we are motivated, how we're inspired, how we're energized. And there's so many different ways of doing this. It is, as we saw, there were three very different ways and four different ways and three very different communities. And I remember the first time we went to the Mississippi Delta. So our friend and colleague, Freddie White Johnson, who founded the Fannie Lou Hamer Cancer Foundation, is an extraordinary woman who has done so much because she will never give up. She is persistent. She is passionate, and she does this all out of love. And I think that was the other commonality, is that people do this out of love for their community, love for their families, love for what they can do, and love for the people that they work with. And Freddie has been building the center for 20 years, I think now. I may be overstating it. But she said to me when I first met her, you have to come to the Delta. You will not understand this unless you go to the Delta. And one of the things that we've been fortunate to do on our team is to be able to do things, be able to go to the Delta, be able to go to Richmond, be able to go to LA, because we don't understand anything until we go to these places. I also think about how many of these same themes and many of these same experiences also triggered and inspired my work in health advocacy, which has been now 28 years, because it's about 30 years from my first diagnosis of cancer. And it was a different kind of different kind of motivation, because I was a young adult cancer survivor, and there are significant issues of social isolation, economic burden, lost opportunities. And I decided I really wanted to work on something. I work in this field so that people didn't have to go through the same thing that I had gone through. And that's what I hoped I would be able to do. But what I've also learned over the years is that I don't want people to have to go through the same thing that I do, but I want them to achieve the goals as they defined them, rather than just considering it from my experience as a young adult cancer survivor. And over the years, I think that's been a more and more important an important motivation and kind of energizer for everything that we do. We say in our team that we learn from communities. We don't learn about communities. We co-create things. We don't go in and say, this is what we can do for you. And it is all built upon what people and communities need, what they want, and how we might be able to align what we do with their goals and their needs. I think the other thing that was really important in this, as we think about health justice, particularly in this socio-political time, is this notion of solidarity and this notion of community. And we heard it from everybody who spoke today. And one of my favorite quotes, I just finished reading a little while ago, Heather McGhee's book, The Sum of Us. And my one of her closing comments, which was one of the inspirations for the Health Justice Summit, was solidarity is the answer. The sum of us can accomplish far more than just some of us.
Mm.
Which I love what that encapsulates, and I love what that shows as a possibility for what we can do together. And I wanted to invite Jamie Trotter and Rita Sharon to see if they had anything that they wanted to say to close. Any further observations you had?
This is a beginning.
Mm-hmm.
We're always beginning anew. And those of you who have been with us for this conversation it's like we're newly born to another moment.
Mm-hmm.
And all that comes before and all we're equipped to do and the training we've had and the misfortunes we've had kind of get transformed inside us into a power. So I entreat all of us to use the power that we do have. Sometimes we feel powerless. Sometimes we feel bested by what has been, sent our way. And I think it's by, Gwen, you give me the wherewithal to keep going. And Jamie, working with you has given me a sense of the joy quotient of this work in advocacy. You can see it, all of you can see it in Jamie. So we're just, we would be nowhere by ourselves. And that's why we're with you all in PAF.
Jamie?
I don't know that there's much to say after that. I mean, I definitely think that this is one of the events that I look forward to each year. It's an event that you hear so many heartbreaking stories, but at the same time, it's riveting and igniting and joyful and hopeful. And I think, considering where we are as a nation, where, the month that we just we
I
just
know.
left. I think that, the stories that were told today, the people that are in this room, the people that are in the audience, are what we need more of. Those are the voices that we work to amplify and that we will continue to lift up, because they deserve to be heard. The stories deserve to be told and shared. And I'm so glad that you received joy from me, because it is not always such a joyful experience. There's a lot of hard work, I think, that is in this type of work, but it's meaningful, it's impactful, it's needed, it's necessary. And so it certainly drives me. And I'm grateful for you, Dr. Sharon, for our continued partnership and the work that you're doing around narratives, particularly in medicine, because it's so impactful. It's a different way of thinking about advocacy. It's a different way of thinking about self-advocacy, but it's something that I think is transformative. It's really and healing. It's very healing.
Yeah. Yeah.
So thank
So-
you.
Yeah.
So, oh, I just swallowed down.
You okay?
No, Jamie, can you do the thank yous?
Okay, and with that, we are done for the night. We have one excerpt that we want to share from our closing from Philip Alberti during our Innovation Summit, and I think it's the perfect wrap up that leaves us with a nugget of hope in what's been a pretty gloomy era over the last few weeks. So we'll play that, and we thank all of you all for participating and being here with us. And we'll see you next year.
Okay.
One ray of hope that I wanted to point out from the election, and I think this speaks to your point about how do we navigate and the focus on the local or the state or the county. So I looked at what happened in Missouri, right? So Missouri voted red in every way Missouri could vote red, but then at the state level, they overturned their abortion ban. They raised their minimum wage, right? And they gave themselves guaranteed paid sick leave, right? Those are those basic vital conditions for health and health equity and equal opportunity. And so I think, it might be trite at this point, but there truly is, I think, more that unites us, more that we agree on as a people than divides us. And the divisions are intentional. It is on purpose that we are looking to find enemies in each other and from within. And so I think the way that we move forward and focus on humanity, and I love that. I think it's a two-step process, because right now I think there's not a lot of listening. And I think another theme that came through so clearly was listening. But I think before either side, all the sides, or so many sides, can truly listen, we do have to find that common ground and get on that common page. And so there are certain things that I take heart in from the work of our own center. And I'll just give you two quick data points, and we can explore or not explore. So we did a poll just of Generation Z. So just nationally representative 18 to 25-year-olds. And there were unbelievably significant areas of agreement, nonpartisan areas of agreement, where 75% of self-identified conservative members of Generation Z said that healthcare should be a human right and that the American government should provide it. 75% of self-identified conservatives. So you're right. We don't need to focus on
That
the
is
discord.
a hope. Yeah.
That is a ray of hope, right? And then the flip side, and we could, or I guess a parallel finding is we tested. There's a lot of conversation now from both sides about reparations, right? The historical way we've thought about reparations, and then this new way that the incoming administration is thinking about reparations. And we tested 7 reparative justice policies from this enormous California report that came out in 2023. And we didn't talk about reparations. We didn't talk about California or race or racial justice. We just tested these policies that would have a racial justice impact, like we should provide more funding for civic engagement education in public high schools, right? 6 other policies, very benign sounding, right? Not leading. And there wasn't a state in the union where those policies tested below 60%. So I think the coupling of finding areas of nonpartisan agreement and then supplementing that with that humane storytelling, with the ability to craft narratives that identify and highlight the common ground, the common goals that all of our communities share, in a way that upends that false narrative of the zero sum, that makes it clear that in solidarity, right, to bring in another theme, in solidarity, these wins can be achieved at the local and the state level, just like wins were achieved for health justice in Missouri just a couple of Tuesdays ago.